Hello, my name is Richard Salhaney. I'm president of the Richmond University Health Network and Chief Administrative Officer for the Medical Center. You know, receiving a cancer diagnosis can be life-altering. At Richmond University Medical Center, we've made it our mission to fight cancer in every way that we can. Over the years, we've invested millions of dollars to wage this war against cancer, creating several ultra-modern facilities like our Breast and Women's Imaging Center at 1161 Victory Boulevard and our Center for Cancer Care at 1000 South Avenue. We've also attracted some of the brightest minds in oncology to assist us in this war against cancer. Many of them are board certified with specialties and fellowship trained experts in their field. From prevention to diagnosis, from treatment to aftercare, Richmond University Medical Center's oncology department is cancer's worst enemy. One of our specialty sites is our Cancer Rehabilitation Service Center, which we're sitting in right now. At the center, our team of specialists provide a wide array of services, including cognitive impairment therapy, home exercise training, and therapies specifically developed for the cancer of the brain, head, neck, and breast. To address some of the questions surrounding rehabilitation services for our patients, I'm happy to be joined by John Travieso, physical therapy assistant at the Cancer Rehabilitation Service Center. Welcome, John. I'm happy to have you here with me.
Thank you for having me, Mr. Salhaney.
Thank you for joining us today. Why don't you tell us a little bit about your background?
Well, I've been a physical therapist assistant for the past 22 years. I've worked in different types of environments and facilities, outpatient, inpatient, long-term facilities, short-term facilities, and I've had the opportunity to help people overcome the greatest of their challenges, to help them in the most debilitated situations, help them get back on their feet, walking again, and return back to their home and family.
Thank you. Well, why don't we dive right into some of the questions we know that our cancer patients have. Why is it so important for a patient to be active during and after their cancer diagnosis?
That's a fantastic question. Well, studies across the board really show us the great benefits of exercises, but especially for those that have been given the diagnosis of cancer, that are undergoing treatment of chemo, radiation. Some of the benefits that include are so extensive, and just some of the things that are beneficial to us may include a decreased risk of reoccurrence, longer life, improved mental clarity, improved digestion because of the physical nature of the exercises, improved quality of life, improved mood, boost of self-confidence, reduced fatigue, reduced risk of injury, increased levels of fitness, leaner body mass, and less weight gain. And these are just to name a couple of things.
Wow. And so what's different about physical therapy as opposed to just working out?
That's a fantastic question. I get a lot of people that ask me this question. If I can just grab some dumbbells, why can I just go to the gym instead of going to a physical therapist? Well, physical therapy is so much more superior in the sense that the physical therapist works very closely with the doctors, with the physiatrists, with the orthopedic surgeons, and we tailor design a custom program fit for every person's needs according to their limitations.
Okay. And so, are there exercises that a person can take home and do with them to follow up with the rehab?
That's definite, for sure. In physical therapy, we work with the individuals to care design a program, a plan of care that's appropriate for their needs. We teach them home exercise programs.
And what kind of physical activities can a person do, say if they're bedridden or if they're limited with their movement ability?
That's an excellent question. So a lot of the exercises that we teach our patients fall under three categories. They're aerobic or cardiovascular exercises. So these are exercises that work on their heart and improve their circulation. We also show them exercises for flexibility training, and we also teach them exercises for strengthening their muscles. So these are things that we can teach the patient to do. Even if they're severely debilitated, they can do these exercises in their bed, sitting up, standing with assistance, and that's the great benefit of exercise. It can be done in any type of posture or position.
That's very good to hear. I hear a lot about the term steady gait. What exactly is steady gait?
Steady gait, that's a fantastic question. And in simple terms, Walking with a steady gait is basically walking with a pattern that is smooth, steady, and even. So that means, and some people use synonymously, steady gait and walking with good balance. So basically it's your ability to walk evenly with good balance without losing your balance, and steady gait helps us to decrease our risk for falls and injuries. Now, conversely, unsteady gait, it's when there's some kind of imbalance or disturbance in our walking pattern, maybe a limp, maybe we're using one side of our body more than the other. And unfortunately, this can actually cause some challenges down the line. I like to remind our patients that if there's some type of imbalance, one thing affects the next. So if you have a pain in your foot, it's going to affect your ankle. That's going to affect your knee. It's going to affect your hip, your back, your posture, even your neck. So we try to encourage patients to walk with improved, steady gait, and that's where we really specialize in helping people to regain their function, their strength, and their steady gait.
Sometimes I hear cancer patients say that they're fatigued and tired from the treatment. What do you suggest, and how can a person be active in order to gain a benefit, especially if they're undergoing treatment that is tiring?
You know, over the past 22 years, I've heard this exact thing. People are tired. They're going through chemo, they're going through radiation, they've been through so many difficult things. Maybe they were at the hospital for a while. And many people say, I'm not in the mood to exercise. I don't have the energy to exercise. There's a wonderful counterintuitive thing about exercise. So we usually say, I don't have the energy to exercise. But the great thing about exercise is that once we start to do it, it improves our mood. We get an increase in our energy levels, and exercise actually combats all of the negative effects and feelings of our treatments and our diagnosis. So the more we move, the better we feel. I've actually had a lot of situations where a patient would tell me, I'm not in the mood for any exercise today. Can we just skip it and go till tomorrow? And I'll always ask them, let's just do 5 minutes. And after the 5 minutes, they begin to tell me, you know what? Can you show me some more? And that's the wonderful thing about exercise. It gives us that energy that we need.
Wonderful.
So at least it starts somewhere.
My thanks to John for providing his knowledge and expertise. I hope we've been able to answer some of your questions. Our Cancer Rehabilitation Service Center is located at 288 Kissel Avenue on Staten Island on the main campus of Richmond University Medical Center. To schedule an appointment, you can visit our website at www.rumcsi.org or call 718-818-3163. Thank you so much for watching. Thank you, John.
You're welcome. Thanks for having me. Great, so this is our demonstration portion. A lot of people ask us, what type of exercises should I be doing to get stronger? What type of things should I be active in? So across the board, studies show us that we should be participating in 3 types of exercises. We should be participating in aerobic or cardiovascular exercises. So in other words, any type of exercise that gets our heart pumping and our circulation going. Second type of exercise that we should be participating in is any type of flexibility training. So that's making your muscles elongated and working on your mobility of your joints. And the third type of exercise that we should be participating in is resistance training. That's working your muscles in a way for them to get stronger, for you to be able to do more. So over the next couple of minutes, I'm going to demonstrate in 3 different positions on how you can do these type of exercises. So let's begin with our cardiovascular or aerobic exercise. On a beginner's level, one of the exercises that we can do is simple marching in place. And if you're able to, of course, if you have any serious medical conditions, you want to consult your doctor. But one of the first basic level exercises that we can do is just like this. You want to get your knees high, march in place according to your ability, and just get your blood moving, get your heart pumping, and get your circulation going. Excellent. So that's one of the beginning ways to get your cardiovascular system working. One of the second type of exercise that we can do is a flexibility training. So we want you to begin to stretch up as high as you can go and breathing during the whole thing and reaching over. And again, reaching over. Excellent. Giving a little twist. and a little twist. Excellent. And on a basic and beginner's level, that's one way to begin some flexibility training to get your body to feel more open and more loose. Excellent. Third exercise is resistance training. So a lot of people think that in order for you to do resistance training, you need all these dumbbells and expensive gym memberships, but it's not really true. You can begin resistance training on a beginner level with your own body weight. So just to demonstrate some of those exercises, for example, what you can do is simple squats, just like this, up and down. Now, just by doing this exercise, what you're working on is you're working on your quads, you're working on your core because you have to stabilize your body, you're working on your back muscles. If you do this position, you're working on your shoulders, your arms, and this is a great way for a beginner's level to begin to do resistance training. Now, I know that we all come from different levels of function, maybe different things that we have as challenges. So I want to show you some other positions to do some of these similar exercises where it may be easier for you. Excellent. So let's take the time to show you some of the same exercises in a seated position. So let's start off with our aerobic or cardiovascular exercises. So right where you are, if you need to be seated, let's begin to march in place. You want to raise up the knees, opposite positions like this. You want to work on your upper body. Get your heart pumping, get your circulation going, and you can do that for about 30 seconds to a minute. And on a beginner's level, that's a great way to start off with your cardiovascular exercises if you need to be seated. Excellent. So that's our first type of exercise. Second type of exercise is our flexibility training. So right from a seated position, you can stretch your arms up as high as you can go, opening up your chest, stretching your shoulders, looking all the way back and this way. Excellent. Maybe you can even open up the arms as wide as you can. Once again, getting a nice good stretch. Right where you are seated, give a little twist. Give a little twist. Reaching over. And reaching over. Good. And once again, the idea here is to get your back and your arms and your upper body just stretched out and looser. Third type of exercises, we did it standing squats, but here, if you can't do the standing squats, I'm going to show you a modified version to do that. So right where you are, especially if you have armrests on your chair with your feet flat on the floor, you can use your arms to kind of give you some help, going up and down, working up and down, just like this. And if you can do 10, that would be fantastic. 4, 5, 6, and so on. Work up to your level, what you're able to do. So in some closing notes, what I would like to say is a lot of the studies show us that we should be exercising about 5 times a week, about 30 minutes every single time. I know what you're probably thinking, that sounds like a lot of exercise to do during the week. But remember, exercise can be done laying down in a seated position, standing, it can be walking around the block, going to your favorite park, doing any type of activity and exercise that you like the most. Now, if something hurts you, if something is bothering you, if something doesn't feel right, here's where a physical therapist can be very helpful and useful. So physical therapists are highly skilled and educated in how to pinpoint the source of your pain and problems. They're able to teach you proper stretching techniques, proper exercises for cardiovascular movement that is appropriate for your specific needs, and how to increase your strength levels in a safe way. Because we want to not only get you stronger, we want to do it in a safe way to help you to decrease your pain and return to your functional level, to return to your family and do the things that you love to do. So this has been my portion. It's been an absolute pleasure, and I hope that you could put some of these things into practice. See you on the other side. Take care of yourself.